So I wish we could just have recorded the backstage conversation that we just had. So we're going to try to tap into that a little bit. Obviously, most of you know Mark, most of you know Jon, and one of the biggest issues that I think are facing the country, the biggest issue I think facing the country right now, from the issue of long-term budgets, investments for the private sector, burden for the private sector. In the public sector, we spend about 30 to 35% of our federal budget goes to healthcare in the form of Medicare for our seniors, Medicaid for the poorest citizens in our country. And the growth of those programs is really driving long-term budget issues. So I think we can have a great conversation here from both the private side and the public side. So I think we start with Mark, who's doing some amazing things at Aetna. So Mark, if you could just give us a minute or two or three on the innovative programming you're doing at Aetna.
So I'll talk about it in 3 levels, and I think Andy Lee's out here. You should all meet him. He's our new Chief Mindfulness Officer, so we're one of
Note
the
that.
Chief Mindfulness Officer.
Chief Mindfulness Officer.
Is now that
Actually, it was exhausting for me to do it, so we need to bring somebody else in.
is it wrong for me to admit now that I sent in my resume for that position?
We just knew we couldn't do it without you.
Okay, good. Just kidding.
So I think about it in 3 levels. You know, we've now had 13,000 employees go through our programs with great results, great stories, and what you hear about are the statistics because that's what the data nerds need in order to justify your investment, which our first investment was $179,000, so it wasn't that expensive. But what was really important were the stories we heard about how families were restored, how communities were restored, how families were engaged, how people didn't take their lives that were thinking about it. And so if you think about saving one life for $179,000, good bet, right? So how do we take that program to the next step, and how do we continue to build on all of the great opportunities we've found so far? We know it's helped us financially as a company. It gave us the strength to make the investment to raise our minimum wage to $16 an hour and to reduce our out-of-pocket costs for our employees. But what it's done is I know it's changed the way we think about how we run a business and how we work with each other. And I'll never be able to prove that because there isn't a way of getting inside of people's heads, but I know it is a huge part of our success as a company. The next step is to get more employers to do it. And so we now have a microsite called a new social compact with employees out on our website for other employers to learn about how we did what we've done and how they can follow in our footsteps and continue the journey in a broader economic community. And then in the third step, our foundation this year alone will make an investment of $1 million in mindfulness, in yoga, as an experiment to learn more about how we can learn more and build an evidence base to make this a standard part of how we care for each other. That $1 million is going to be part of a broader program where we will engage metropolitan areas across the United States to redefine health as a productively viable and happy human being, and engage in programs like mindfulness yoga, bike paths, urban farms, blue-green algae on rooftops, all that cool stuff, to be able to demonstrate that we can make communities healthier and more productive and happier, which could go a long way, Tim, in restoring some of our confidence in the debacle we see going on around our presidential election right now and the way people treat each other.
I have no idea what you're talking about.
You guys. I mean, the great thing about being on stage with Tim is that in the polls of how people think about people, healthcare insurance executives are pretty low, but we have the very firm shoulders of Congress.
Yeah, right.
I'm here to help, whatever I can do. So, Jon, you've been doing this for a long time, but not just the mindfulness piece. I think why so many people respect you and your opinion is because you've always seen this as part of a broader engagement with the healthcare system.
Yeah, exactly.
And so I would be interested in your vision of what does an ideal healthcare system look like when you are moving it from a place of mindfulness and stress reduction and attention, awareness, focus.
Well, I don't think anybody really knows, but at least we can sort of paint a little bit of an impression of what it might be. And by investigating it and enacting it, then we continually learn. So the whole idea of mindfulness-based stress reduction back in 1979 was to use the environment of a hospital to catch people falling through the cracks of what we would call the healthcare system. And many, many people, it turns out, fall through the cracks of the healthcare system. And to challenge them to do something for themselves in a kind of form of participatory medicine that would tap into their deep interior resources, which everybody has by virtue of being born and being human, for learning, for growing out of the learning, for healing, and for transformation. Not as a kind of the opposite of healthcare, but as a complement to whatever medical treatments and so forth people can have. But the basic idea was to have hospitals actually teach people how to stay out of the hospital and to use the hospital much more wisely and to use the medical system much more wisely. In fact, what we have so far is much more a disease care system than a healthcare system. We're not knocking that we have a good disease care system, although it's very, very expensive. But what if we could rotate that in consciousness so that we're teaching people, so to speak, how to be healthy across the lifespan through diet, through exercise, through yoga, through meditation, through a sense of deep interconnectedness with others and purpose, and then let that kind of be the sort of default mode, so to speak, of how we live our lives. And then, of course, untoward things always happen, and sooner or later we're going to die. But the question, I mean, people often ask me, well, Oprah once asked me this thing, well, Jon, just out of the blue, what do you think about life after death? And I'm saying, Oprah, I'm not that interested in that question. I'm much more interested in, is there life before death? And so you see where that's going. It's like, how can we actually live the moments that are ours to live? That's what yoga is all about. And then let the awareness be a kind of full spectrum awareness that doesn't stop at the skin, but that goes deep down into the bones, into the genome, into the telomeres, into the connectivity and plasticity of the brain, and also out into the social networks, and into government and into society and globally. So that would be a kind of redefinition of what we truly mean by health. And I think that your work at Aetna is just a kind of object lesson for all of us to kind of wake up and realize that whether it's how much we're paying our workers or how the systems that we develop, that as long as we come in with an old mindset that's really like more like auto mechanics than anything else. You drive your car until it breaks down, then you go in and get a new liver or a new carburetor or whatever. And that's not to say that at times people don't need that kind of high-tech medicine, but why not develop a truly participatory, mindful, heartful medicine where people live their lives in community and let the community actually nurture that? And you told me backstage this phenomenal idea about the phrase you used was Uber nurses. So I'd like to just really hear what your vision is for how to actually bring that into the society in a way that would globalize, generalize, way beyond hospitals.
Well, yeah, I think, Jon, and you've laid all this incredible foundation and framework for all of us to work with, so thank you very much for the incredible work you've done. You make my job a lot easier, making it But think of this as an idea. In the 1850s, you have to have a broader heuristic about how to fix problems than looking at the issues you're facing today, because you're bound to repeat your problems if you don't. So if we go all the way back to the mid-1800s, we had an agrarian society where people worked together, they grew things together, they made things together, and nobody fell through the cracks. They lived in community. And we had the Industrial Revolution, the Information Revolution, the Knowledge Revolution, and we lost all of that. And so now we find community on these devices we carry around in our pockets. And to some degree, it's interesting because we have bigger communities than we had before, but yet that isn't what people want. So what if we turn the healthcare system around, as you suggest, John, and we say, a healthy individual is productive, viable, socially, spiritually, and economically, and happy. And we want to do that person by person, community by community, then that has to start at home. It can't start anywhere else. It can't start in a hospital or a doctor's office. It has to start at home. And what if we redefine work as instead of working for the man, which is what I always swore I would never do, now I am the man. What if instead of working for the man, you work for yourself? And you work in community and taking care of people in the community. And the best place to do that is healthcare. Why should people have to leave their houses to go to a doctor's office or to see someone for care? Why can't we bring stuff, people, and technology to the home? And why can't we keep people there? And why do the people that do that have to work for somebody? Why can't they work in community? So there's a technology called TaskRabbit where you have the ability to sign up for philanthropic work. I've done it a couple of times. And you go and you ride around, I ride around and deliver Meals on Wheels on my bicycle in Manhattan. And what if you could do that with healthcare? And you could say, I'm going to sign up from 7 to 11 today and from 6 to 10 tonight, and I'm available for these services. Who in my community needs me? And we'll pay you differently. And you can walk to work, and we can reduce the carbon footprint. And you can be in community, and you can be home with your families, and you can do all of that work. That's what the healthcare system should be like. And you only go to the doctor or the hospital when all of that doesn't work. Excuse me, except for my cold. Which is the other way around today. We all start in the wrong place. So we start at the home, we start around this idea that health is a productive, viable, and happy individual, then we'd have better communities, a better society, and a better dialogue in Washington if we could make that all happen. And then our system in its capacity wouldn't be undercapacitized. We worry about not enough doctors. We have plenty of doctors. We just use them the wrong way. We have plenty of hospitals. We use them the wrong way.
This is
Let's
an
use them by
incredibly
exception.
important message that you don't hear from too many people. And I think it really bears underscoring that if we see through the wrong lenses, we're going to get the entirely distorted picture of what would be required to actually heal and transform the society, the way it takes care of its citizens,
It's people.
Well,
And so the OECD nations, there's a study. If you look at all the OECD nations, and you look at the percent of GDP they spend on healthcare and the percent of GDP on social programs, and you add them together, the United States is ninth. Ninth. All the nations are within 5% of one another except for Mexico and Korea. All of them spend less than 50% of that amount on health care and the rest on social determinants of care. Safety, shelter, food, water, social engagement. And so I would make the argument that if we start at the home and we make our investments in social determinants, you could make the argument that we're underinvested or invested poorly in social determinants of health because we've lost community and we've turned it to the government. And because of that underinvestment in the way we approach it, we now have a healthcare system that costs too much.
That's the end of the conversation, I think. Good night, everybody. It's been great having you. Drop the microphone.
Well, no, Plato would stop there, but Aristotle actually had to go do it, right?
So this is just really interesting in the context of, because we all live in the context of the world we're living in and the presidential election, and I feel the same way when you're talking about community. So in the Medicaid program, for example, communities like Detroit that you grew up in, or Youngstown, Cleveland, Ohio, where I am, you have 80 or 90%, sometimes 100% of the kids that are in a school will be Medicaid. And we'll sit there and wait until those kids get diabetes or hypertension or any issue, and then they'll come into the system and we'll take care of them, and that's driving the cost up. And what's important with what you're saying is from the governmental side, we need to do the same thing. Why are we waiting till you get sick? Then we'll take care of you. How do we use some of that money to play offense, not just in the home, but in the school, where you know these kids are going to be? And to me, that's how you bend the cost curve in the long run.
So what you're saying is that we have plenty of resources in this society. We just don't know what we're doing.
And I think that's an important point, because the debate in Washington, as you know, is we need to spend more, we need to spend less. Cut government, increase government. When the reality of it is, it's about innovating in a way that realigns the investments that we're making.
Now, there's something that really has been implicit, but I think it's worth making it explicit. You and me sitting on the stage, and virtually everybody in the audience understands that one of the, if not the key element to any kind of profound transformation is to have a practice of some kind. This has been brought out by many people on the stage and in our conversations together over the past few years. So I would love to hear you speak about how you bring your own life and practice and life experience into the unfolding of your largest view about how to transform healthcare into this society, so that one, it's caring, and two, it works in a profound way.
Well, I don't think anybody can lead effectively unless they have a personal practice that presents their best self to the world every day. And because the journey is inward, because the requirement is that we need to have a trust model in order to make these changes, to take the steps that we need to take, like we did with minimum wage and with yoga. You have to convey a sense that you believe, not what's right. I mean, the worst thing we've ever created in the United States, and we've destroyed economy after economy, is the spreadsheet. Because we put numbers on it, and it's called truth.
Yeah.
And then we manage the variance to truth. And it's all BS, quite frankly. It's about what are the assumptions behind it, and what do we need to believe. And in order to believe, you have to trust. And the only way you get trust is that you give it. And to give trust, you have to have a personal practice, and you have to take the inner journey to make that first step. Because unless you know who you are and what you stand for, you can't begin to trust others with your ideas and your beliefs in order to make change.
And no matter how healthy you would be in terms of your biology, if you're not connected to the deep elements of who you are and how you are in relationship, then really you couldn't be said to be healthy at all.
Right.
Oh. You know, it reminds me, there's a panel later with Michael Gervais and Pete Carroll, and I watched clips of Michael, who's the sports psychologist for the Seattle Seahawks, and he talks about, as an athlete, being vulnerable. You know, you can't be great, and Michael's probably here, he could articulate this much better than me, but you can't be great unless you're vulnerable. You really can't lead unless you're vulnerable too. And I think that's part of the rub now with the presidential. I hate to keep bringing it up, but it is on TV all the time, infiltrating us as we speak. But there's very little vulnerability. There's very little, I'm going to say this, and I know that, you know, at the end of the day, it may hurt me, but I need to say it because I think it's the best direction for us to go in. And it was like, you know, watching Trump the other day about he beat up George Bush about going into Iraq. And then in a town hall meeting, someone asked him about it. He's like, well, I didn't really say that. You know, I was like, wait a minute, you were just on TV for like an hour saying it all the time. And then you just, so what his instincts maybe were, he had to pull back from because there was a level of vulnerability there. So I think from the public side, I think for me, and this is a reminder to myself, you've got to go out there with these ideas. And I think a lot of people would like to hear the fact if someone says, we don't need to spend more, we don't need to spend less, we need to spend the same, but we got to rearrange it in a lot of different ways. I think that would get somebody's attention who would be tired of the one side or the other argument, because neither of those are working, quite frankly.
And if I may, I'd like to point out and really also ask you about how this figures in your work, that now there is an ever-growing science of mindfulness and science of yoga that really brings a deeper understanding of what it means to be human in the sense of the plasticity of our biological systems. So not just neuroplasticity, that meditation and exercise and all sorts of different things, including how you eat and how you are in relationship, actually transforms not just activity in the brain, but the real estate of the brain in ways that develop profound connectivity between regions that before may not have had it. There's just something that came out in the New York Times this very week by David Creswell at Carnegie Mellon, a beautiful study of mindfulness versus relaxation that shows brain changes when you pay attention to the body, no brain changes when you don't, and also inflammatory markers that go down in the mindfulness case and not. So we're learning that in terms of longevity, in terms of gene expression of inflammatory genes and so forth, that these kinds of practices actually, they're not just like sort of like, Om Kumbaya, we're all one, but they actually, not that I'm knocking that, but that there's actually transformation going on, that the more you get out of your own way, the more it happens. And the more you try to get the transformation, or I have to lower my blood pressure, or I have to calm my mind, or all of that stuff, you're going to learn that it's a practice of non-doing rather than adding one more thing in or forcing anything to happen. So this is kind of a new principle, so to speak. It's very, very ancient, but we're bringing it now into the modern world through the science and through the medicine of mindfulness and so forth. And it really has the potential to, in concert with what you're saying, to transform our very understanding of what it means to be an institution, a corporation, or a corpus, a human being in relationship in your own home, and how to take the 24 hours that each one of us gets. It's like nobody gets a little extra or nobody gets a little less. And to actually make use of those moments and those days and those breaths so that we actually live the life that's ours to live in its fullness while we have the chance, which is only now. And to me, that would be health right here, right now, starting with whatever your basic diagnoses are or medical conditions or anything else. And when we see that unfold in the hospitals, it's just staggeringly beautiful that you can be healthy with cancer. You can be healthy with back pain. You can be healthy with what some people call disabilities that, enable you in other ways. So it's like really we need to, in some sense, wake up to the limitations of our definitions of what it means to be human in my own body and what it means to be human in community. And I think that this meeting is actually, and this conversation and all the other conversations on this stage are actually diagnostic of that already happening in profound ways, and we all need to, in some sense, contribute to it. Whether you work for Aetna or you work someplace else or other, or you're in the home, whatever it is that you're doing, that's the most important thing on the planet at this particular moment for you to be doing. And if you're doing it consciously, then in some sense, maybe we will get healthier, but in another way, we're never going to be any healthier than we are right in this moment.
So, Mark, one of the things that drives the healthcare system is incentives, reimbursements, not to get too technical. But can you talk a little bit about how we would, whether it's from Washington or within insurance companies, how do we shift the incentives, the reimbursements, so that people who teach MBSR, for example, can get reimbursed to do that? People who teach dietitians and nutritionists, how do we create that system?
So we need to create an evidence base that's large enough to rely on. Now, there are ways to pay for it today. So if you have an FSA or an HSA or an HRA, you can pay for those services through those funds. So that makes it available to you. We do offer a number of alternative or complementary therapies that are covered depending on the employers that want to cover them. So yoga, acupuncture, energy medicine. But it really depends on the belief of those providing the coverage as to whether or not they believe it can help. And so we need to build out that evidence base, and that's why, we'll make a $1 million investment through our foundation this year alone in building out more of that evidence base. We're doing with Goldie Hawn Foundation mindfulness in the schools, in inner city, middle schools where there's a lot of violence and fear, and we're having incredible results. We should pay for that. And so more and more of that will come along. Unfortunately, some of us won't live to see it to fruition, at least in this life.
Not a problem.
Right, in this one, but
Yeah.
at some point. But I think that's the kind of science we now have the ability to build, as you say, and to invest more in as we move ahead because it's less expensive. Now, in some cases, for example, in our Medicare population, we actually pay for services outside of the benefit plan because it's a better investment. Somebody needs a ramp for the front of their house, we build it. Somebody needs an Uber, excuse me. Somebody needs an Uber ride for their, driving. Somebody needs an Uber ride to get to the senior center to socialize, we do it.
Wow.
So.
I'm amazed at how progressive you are, how your company is, and I just think if we had 20 other CEOs like Mark, where this country would be right now. And I wonder, people ask me all the time, meditation, yoga, and the stuff that I do, what do your colleagues think about it? So I'd like to ask you, the CEOs that you interact with, what's their opinion of this?
Well, when the CEO does it, everybody has to do it, right?
Yeah. Other CEOs, though,
You're the man.
You are the man, yeah.
But when others, it was funny, when I started talking about it, my team's going, oh, bud, you better be quiet. People are going to think you're a nut. They're going to think you're woo-woo. You're not running a commercial enterprise. Or you a not-for-profit all of a sudden, you're going to be a bad guy. That was back when our stock was at $32 a share. It's at 107 today. But what I found was a bunch of other CEOs that were doing it that didn't talk about it because they were afraid of it. And now they are. And you hear now it's cool to be mindful as a CEO. But I think in the authentic version of it, I think people who are present, aware, vulnerable, being who they are, you can see it in the way their followership flows. So leadership comes from followership, not from being anointed. And so in order to build that followership, you have to be authentic, you have to be vulnerable, you have to be real. And that's been part of my mission. And 1979, I was putting together rear axles at Ford Motor Company after flunking out of college for the second time. And here I am running a Fortune 20 company.
Okay.
Ford Motor Company, great company, by the way. But here I am. So I have this huge opportunity to take this gift that I've been given and turn it into something bigger. And so we have a microsite for CEOs to look at. We encourage them to engage in the dialogue to be better. I think if we have a capitalist system that's broken by any measure of any person in the system today, including CEOs who would say it's broken. Our incentives are all wrong. And I gave my team a copy of Thomas Piketty's book on capitalism in the 21st century because I said, you know what? It's ignorant. It displays ignorance to challenge other people's ideas unless you understand them. Yet we have people that challenge other people's ideas all the time out of ignorance, and they get applause lines for it, and it's wrong. And so what we need to do is we need to educate everybody, and if we as captains of capitalism don't change the system, it will fall apart, and we should find our way. And part of that is through mindfulness and authenticity and vulnerability in leading our way forward. If we don't reinvent it, who will? And at a time it worked. It doesn't work today.
Part of the charge, I think, for this crowd that I've been trying to say for the last few years is how do we mobilize politically? And I'm not getting into Democrat, Republican, but when you know the system needs to change and there aren't enough people influencing that through the electoral process, it's up to us to be a part of that system. And you could go down the line and say, is this liberal or is this conservative? It's way deeper than that.
It's
you know?
sane.
It's sane. You know, like Jim Wallace used to say, we don't need to go further left. Pastor Jim Wallace, we don't need to go further left. We don't need to go further right. We all need to go deeper. And if you go deeper, you start to see, just from what Mark was saying, arguments that would appeal to both people who are into mindfulness, yoga, health, nutrition, urban gardens, and all the rest. And then you would also appeal to people who are interested in long-term budget deficits and the government not working and it's dysfunctional and it's a waste of money and all the rest. So there's a message here that I hope we can take to the next step, maybe with the CEOs who are into this, with government officials who are into this, with healthcare people that are into this, and really broaden this as a campaign. Because at the end of the day, if this doesn't get down to the kids in Youngstown, Ohio, I don't care about it. If it doesn't get down to the kids in Detroit, where we can make the argument that we're not spending money properly on these things, we're wasting money, and instead we want to spend that money on clean water, safety in our neighborhoods, good schools, healthcare, healthy food. I think most people would buy that. I think most people would want to be a part of that. And so I think as we kind of wrap up here, I think that would be the charge. John, do you have any closing nuggets of wisdom?
No, I'm too happy to say anything. And
Thank you, Tim.
Thank you very much.